Kikhubor ka Batesi TV. Lawan Rashapi taka Frank Motors, the all-new Altros. Now, with more exciting features.
Ka IZ Group of Institution Bangalore, kadai ke college babhatam nagabanta ka jingkuli nursing but paramedical course, hospital training, pinyo scholarship but 6% ka kam, haki hospital bahedo India but shabari. Nabanta ka jingkuli ka jingseo ka paret but pila ban lagu ban kuli da ka education loan. Pila ruban syukola ho number kandai nyo saw san riu pranot. Lani kandai pran riu license, arn riwe kandai pra.
Menteri Rangba Kejela Conrad Kongkal Sangma haka arfulai terik unailar arhajar arfulai. Ula Plie ba ya ka MRI machine han Nazareth Hospital Shillong nagbentaban penjanai syuk ya ka jing syakri ya kinongpang kibawat jing sumar hagani ka hospital kabala pau khmat bha hagani ka Jela Meghalaya. Nakaliang jong Menteri Rangba ula kularu ban ai jing yarap arfusan lak tingka syagani ka hospital nagabha Chief Minister's Office khnang bagani ka hospital kanang la ban pentulun syakman yaki kam syakri ba hagani ka Jela. Hagani ka sngi la sakhilang da u lengdo asat ka Jela niamba Shillong Most Reverend Victor Lengdo ka administrator jong ka hospital ka Sister Noreen Chief Medical Officer jong ka hospital Dr. G Rangat ki doctor, ki nurse, but ki bala shakhot sngoba.
We have computerized the process in which the ushers today now get their benefits. No longer do they have to manually write, but everything is on technology. And from the date they are able to upload on the portal, in a matter of week to 10 days, they are able to get their incentives, which otherwise used to take months and months, sometimes even a whole year. And hence these kind of reforms have allowed the human resource aspect also to be managed better, and we are seeing the manpower overall performing much better at the grassroots, and we expect things to improve much more in the coming years. After tomorrow we'll be making some major announcements. Our Honorable Health Minister will make the announcements after we've passed it in the Cabinet, where we will be announcing the plans for at least 3 medical colleges that are there. And we'll be putting in a timeline on how long it will take, at the same time the money that's going to be spent on it and the working mechanism in which it will happen. And with the completion of these 3 medical colleges which are going to be there, I'm sure that we'll be able to produce almost more than what we are getting today, and very much, as I said, in the comfort of our own state. The hard work we've put in the last couple of years, and especially last few months, the Honorable Health Minister has been very, very particular about this, and it required certain financial interventions which had to be done at my level, and we have done that last week, and now it's only a cabinet note which is waiting to be approved. And as I said, this again will be a major step towards ensuring that our overall human resource requirement that is there will be met in a very planned manner. Apart from that, we also heard Dr. Rangat mentioning about another aspect, which is the insurance aspect. And as you know that Meghalaya has maybe one of the better health insurance programs, much larger coverage compared to what other states are getting, and in a much more efficient system that people are getting the benefit of this. We are working very hard to make it even better. I will refrain from going into details because they're still at the discussion stage, but I do expect that we will see a major reform, and the ease with which this will be worked out will be better in the future. So not only is this one of the better schemes in the country today, but we are intending to make it one of the best and make it much more easier for the people so that they can get the benefits of the insurance. One is the procurement of the medicines for our state. We have decided to completely go for a computerized based system, and indenting that will be done in a much more scientific manner and centralized manner, of course getting inputs from everywhere. And it will be a system that is going to be more professionally run because we are seeing that there's a lot of wastage of medicine, and therefore it can be reduced and maximum utility can be obtained by having a bit more professional approach to it. So in a matter of few weeks, we will see this also roll out, and we should see that this entire medication issue should be resolved to a large extent. We are also working very aggressively to come up with what has been going on with Government of India, what we call Jan Aushadhi Kendras. These are generic medicines that are available at a much cheaper rate. We have decided to come up with our own Meghalaya's Jan Aushadhi Kendra because the one from the center, though benefits are there are a lot of bottlenecks for which our people are not able to apply, and the supply chain is not very good. So we are trying to come out with our own stores where we will run it through entrepreneurs and local people, and this will allow the people to get generic medicines at a much cheaper rate at the rural level, and this again will be a major transformation in terms of the health sector. Also the involvement of a large number of different companies and NGOs who are now working with us at the sub-center level is also allowing us to now uplift the overall sub-center to wellness centers, and hence more services will be available at the grassroots level. So that is one thing that is also a very transformational thing that's happening at the grassroots. Another very important aspect which is going to be coming in, and it has already started, we are working on it for the past 2 years now, but we have not spoken much about it, is the technology aspect. And we are actually going for a very strong patient management system where the records will be all computerized, and the records will be available obviously only to respective doctors, but all the aspects that will be there will be computerized. The registers and the information will be maintained in a computerized manner. All of this implementation of technology will allow the doctors now to spend more time on actually medical work rather than spending time on writing reports and all these aspects. It will also allow us to keep the history of the patients, so that at any given time we are able to, with the concerned doctors and with the concerned authorities, we are able to then ensure that at any given time, with the patient's permission of course, that we'll be able to then share that information to their doctors, whoever they would like to share it with. So this technology implementation is going on as we speak in Riboi district, and it is very, very successfully going on. And once we are able to complete this pilot project in Riboi, we will see this technology being implemented throughout the state. This will be a major game changer in the health sector, because then we will be able to really have a full database, I should say. And this database is not just about how we manage the patients and the records, but it is also a record on kind of a data analytics for us to really see that which region is having what kind of ailment, which season is having what kind of ailments, which time of the month or the year do children have certain problems. So it's a very strong data analytics that will allow us to then project and plan ahead of time for major policies and interventions, so that we are able to have a more of a preventive kind of approach to the entire health sector.